Hello dears, in this video, you will see the common gynecological problems of females of every age. You can visit Professor Tayyaba Majeed for consultation at Hamid Latif Hospital, Garden Town, Lahore.
Polycystic ovary syndrome COS. COS presents with irregular periods, excess facial and body hair hirsutism, acne, and weight gain. Women may also experience infertility due to lack of ovulation and develop insulin resistance, leading to diabetes. Cervical dysplasia, often asymptomatic. Cervical dysplasia may cause abnormal bleeding between periods or after intercourse. In advanced stages, it can lead to pelvic pain and, if untreated, progress to cervical cancer. Endometriosis manifests with pelvic pain, especially during menstruation, intercourse, or bowel movements. It can cause heavy periods, infertility, and fatigue. Some may experience digestive issues or pain with urination. Fibroids. Symptoms of fibroids include heavy menstrual bleeding, pelvic pressure or pain, frequent urination, and constipation. Depending on size and location, they may cause infertility or complications during pregnancy.
A breast lump is a localized swelling or mass in the breast tissue. While many lumps are benign, some may be cancerous. Early detection through breast self-exams, mammograms, and clinical examinations is crucial for timely treatment and improved outcomes. A breast lump is a local
Menorrhagia. Menorrhagia presents with heavy menstrual bleeding lasting longer than 7 days. Passing blood clots, fatigue, shortness of breath, and anemia. Symptoms like weakness and dizziness. Gestational trophoblastic disease (GTD). GTD symptoms include abnormal vaginal bleeding in early pregnancy, severe nausea, and vomiting. Hyperemesis gravidarum, enlarged uterus disproportionate to gestational age, and high levels of human chorionic gonadotropin (HCG).
Uterine prolapse symptoms include a feeling of heaviness or pulling in the pelvis, tissue protruding from the vagina, urinary incontinence, and difficulty with bowel movements.
Mastalgia, or breast pain, can have various causes, ranging from hormonal changes to underlying medical conditions. Here are some common causes of mastalgia: hormonal changes, fluctuations in hormone levels, particularly estrogen and progesterone, can contribute to breast pain. This often occurs during menstruation, pregnancy, menopause, or hormonal therapy. Breast tenderness. Some women may experience breast tenderness or pain as a normal part of their menstrual cycle, typically occurring in the days leading up to menstruation. Fibrocystic breast changes. Fibrocystic breast changes involve the formation of benign lumps or cysts in the breast tissue, which can cause breast pain or discomfort, especially before menstruation. Breast trauma or injury. Trauma or injury to the breast, such as bruising or strain from physical activity, can lead to localized breast pain. Breast infection. Mastitis. Mastitis is an infection of the breast tissue, often occurring in breastfeeding women due to milk duct blockage or bacterial infection. It can cause breast pain, redness, swelling, and fever. Medications. Certain medications, such as hormonal therapies, oral contraceptives, or hormone replacement therapy, may cause breast pain as a side effect. Breast surgery or procedures. Breast surgery, including breast augmentation, reduction, or biopsy, can lead to temporary or persistent breast pain as part of the healing process. Costochondritis. Costochondritis is inflammation of the cartilage that connects the ribs to the breastbone. It can cause chest pain that may radiate to the breasts. Muscle strain, strain or tension in the chest muscles, often due to poor posture, heavy lifting, or vigorous exercise, can result in breast pain. Psychological factors, stress, anxiety, or emotional distress can sometimes manifest as physical symptoms, including breast pain. It's important to note that while mastalgia is often benign and temporary, persistent or severe breast pain should be evaluated by a healthcare professional to rule out underlying medical conditions, such as breast cancer or other breast abnormalities. If you experience new or concerning breast pain, it's advisable to seek medical attention for proper diagnosis and management. Consult Professor Zahid Mahmood at Hamid Latif Hospital Garden Town for treatment. Or call 0300 413 0159 for an appointment.